Welcome to this short video giving an overview of the palpitations map. This doesn't cover atrial fibrillation, there's a separate map for that. However, it does cover sinus rhythm and tachycardia, management of SVTs, and management of ectopic rhythms. The key messages here are if they remain symptomatic despite first-line treatment, then refer to cardiology. Other reasons are diagnosis uncertain and symptoms ongoing, red flags present, sustained tachycardia of over 30 minutes, or a broad complex tachycardia. If the symptoms have settled, do not refer. Please just reassure the patient. So what are the red flag features? Basically, these are adverse features of arrhythmias, a structural heart disease which is known or likely to occur, an abnormal ECG, known coronary artery disease, valvular heart disease, heart failure, unexplained murmurs, chest pain, syncope, a family history of sudden death under 40, intrusive symptoms which persist after initial treatment, and all paroxysmal non-AF SVTs, unless they're very short and infrequent. These can be cured with ablation in the majority of cases. An ECG, therefore, is a vital part of the workup. Diagnostic gold standard is an ECG correlated with symptoms. However, if the symptoms persist and you're unable to capture it on a 12-lead ECG, then if they're getting the symptoms more frequently than 3 times a week, do a 24-hour tape, if not a 7-day event recorder. The other thing to highlight is under patient and carer information, we have a couple of useful patient information leaflets which you may not be familiar with, and that is from the Arrhythmia Alliance. There's a good leaflet on supraventricular tachycardias and also inappropriate sinus tachycardia, and a good leaflet on ectopic beats from the Atrial Fibrillation Association. The boxes here show you what you need to do. SVTs are treated primarily with bisoprolol or diltiazem, sinus tachycardia largely with reassurance. Interestingly enough, ectopic beats are often benign but not always, so check for red flags in the history, and if you do a 24-hour ECG, then if there are over 1,000 ectopics in the 24 hours, arrange an echo to rule out LV dysfunction. If these are normal, provide reassurance and explanation for the symptoms. Saying nothing wrong rarely helps. Medication is rarely required, but a small dose of a beta blocker can be considered. Thanks for listening.